I need water. I need water. I need water. I need water. Hey guys, Dr. PingPoy here, and we're gonna tackle the next system, which is the urinary system. The urinary system filters blood, eliminates nitrogenous waste, and helps maintain the ion concentration of body fluids. The blood arrives at the kidney via the renal artery. Each kidney contains 1.3 million tubular nephrons, the functional units of the kidney. Each kidney receives blood through the renal artery, which branches out into the capillaries surrounding each nephron. The kidney's capillaries eventually converge into the renal vein, which carries cleansed blood out of the kidney and finally to the heart. Three processes contribute to urine formation: filtration, reabsorption, and secretion. Filtration. Fluid and dissolved substances such as water, urea, glucose salts, and amino acid enter the nephron from the blood. Reabsorption. Water, glucose, salts, and amino acids return to the blood from filtrate. Secretion. Toxic substances and hydrogen ions are secreted into the nephron to be eliminated in urine. To maintain the blood pH in our body, we need these three mechanisms: the buffer system, respiratory compensation, and renal compensation. The carbonic acid bicarbonate buffer system is the first line of defense. If the pH in the body is high or low, it brings it back to normal. The pH buffer system works to minimize changes in the pH of blood by adjusting the proportions of acid and base. An increase in hydrogen ions would attract bicarbonate ions and produce carbonic acids. Conversely, reduced hydrogen ions would dissociate carbonic acids into hydrogen ions and bicarbonate ions. Respiratory compensation involves the release of carbon dioxide from the lungs. The brain regulates the amount of CO2 by controlling the speed and depth of ventilation. When arterial hydrogen concentration increases, the rate and depth of breathing also increases. Conversely, when arterial hydrogen concentration decreases, pulmonary ventilation also decreases. In renal compensation, the kidneys can excrete hydrogen ions and bicarbonate ions, and even secrete ammonia. The kidneys are tasked to eliminate hydrogen ions derived from sulfuric, phosphoric, lactic, and other acids through urine. This process increases during acid loads and decreases during alkali loads. The normal blood pH in the body ranges between 7.35 to 7.45. Acidosis refers to an increase in acidity, meaning when the blood pH is below 7.35. Acidosis may result from inadequate function of the lungs, which causes arterial carbon dioxide and primary decrease of plasma bicarbonate. This results in a decrease of cardiac output, which a person breathes faster and deeper than normal, leading to an increased heartbeat. Acidosis may also lead to diabetes. Alkalosis, on the other hand, refers to an increase in alkalinity, meaning when the blood pH is above 7.45. Alkalosis may result in excessive exhalation of carbon dioxide and primary increase of plasma bicarbonate. A person with alkalosis may have difficulty in breathing, dizziness, and hypokalemia, or low potassium level. And that is it for today, guys. Hope you all enjoyed. It makes you wonder, what about the last system? How do we make babies? Stay tuned for the next system. This is Dr. PingPoy. Thank you.